Welcome back to Mind Diagnosis Lab, Episode 7, Unveiling Depression. The science behind the shadows. Depression is more than just a fleeting feeling of sadness. It's a complex and multifaceted mental health condition that has affected almost 280 million worldwide. William Styron once wrote about his experience with depression as a despairing, unchanging paralysis of the spirit beyond anything I had ever known. In this episode, we delve into the intricacies of Major Depressive Disorder, MDD, and Persistent Depressive Disorder, PDD, exploring their symptoms, causes, and impacts on individuals and society. Section 1. Understanding Major Depressive Disorder, MDD. Major Depressive Disorder, commonly referred to as MDD, is characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in nearly all activities. These episodes last for at least 2 weeks and represent a significant change from previous functioning. But here's something crucial. No two people experience depression the same way. A 2015 study by Fried and Nesse found over 1,000 unique symptom combinations, with no one pattern shared by more than 2% of patients. Symptoms must be distinct from normal grief or responses to life stress. They also interfere with daily functioning, from relationships to work and physical health. Diagnostic criteria. According to the DSM-5, a diagnosis of MDD requires the presence of 5 or more of the following symptoms during the same 2-week period, with at least one symptom being either depressed mood or loss of interest or pleasure. Depressed mood most of the day, nearly every day. Markedly diminished interest or pleasure in all or almost all activities. Significant weight loss or gain, or decrease or increase in appetite. Insomnia or hypersomnia. Psychomotor agitation or retardation. Some move slowly and speak softly, while others can't sit still, pacing and fidgeting anxiously. Fatigue or loss of energy. Feelings of worthlessness or excessive guilt. Diminished ability to think or concentrate. Thoughts may become sluggish or chaotic. Anhedonia, the inability to feel joy or interest in things that once brought happiness. Social withdrawal is also common. Self-neglect can follow. And for many, the burden becomes so unbearable that suicidal thoughts emerge. These symptoms cause significant distress or impairment in social, occupational, or other important areas of functioning. Section 2. Prevalence and impact. MDD is one of the most prevalent mental health disorders globally. College campuses now report record levels of depression among students. In the United States, approximately 7% of adults experience MDD annually, with a higher prevalence in women compared to men. The onset often occurs in late adolescence or early adulthood, but it can affect individuals at any age. According to Kessler et al. 2003, about 16.2% of people in the U.S. will experience MDD in their lifetime, and around 60% of those with MDD also meet criteria for an anxiety disorder. Also, men are more likely to become depressed after job-related stress, while women are more vulnerable to interpersonal stressors. The impact of MDD extends beyond the individual, affecting families, workplaces, and communities. It is a leading cause of disability worldwide and contributes significantly to the global burden of disease. Section 3. Persistent Depressive Disorder, PDD, the chronic shadow. Persistent Depressive Disorder, formerly known as dysthymia, is a chronic form of depression characterized by a depressed mood that lasts for at least 2 years. While the symptoms may be less severe than those of MDD, their chronic nature can lead to significant impairment. Unlike MDD, which comes in episodes, PDD is chronic, lasting most of the day, more than half the time, for at least 2 years. Some people suffer from both MDD and PDD, a condition called double depression, where the baseline is already low and major episodes come crashing on top. Symptoms of PDD. Individuals with PDD experience at least 2 of the following symptoms: poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, low self-esteem, poor concentration or difficulty making decisions, feelings of hopelessness. These symptoms are present more days than not, and can persist for years, leading to significant challenges in daily functioning. Section 4. Biological underpinnings. Both MDD and PDD have complex biological underpinnings involving genetic, neurochemical, and neuroanatomical factors. Genetics. Family and twin studies suggest a heritable component to depression, with estimates indicating that genetics accounts for approximately 40% of the risk for MDD. Neurotransmitters. Imbalances in neurotransmitters such as serotonin, norepinephrine, and dopamine are implicated in the pathophysiology of depression. Brain structures. Neuroimaging studies have identified structural and functional abnormalities in brain regions associated with mood regulation, including the prefrontal cortex, hippocampus, and amygdala. Section 5. Cultural and environmental influences. Depression does not occur in a vacuum. Cultural and environmental factors play a significant role in its manifestation and experience. Prevalence ranges from 6.5% in China to 21% in France. Brumet et al., 2011. Higher rates are seen in countries with more income inequality or less sunlight, a risk factor for seasonal affective disorder. Gender differences. Women are nearly twice as likely as men to experience depression, potentially due to a combination of hormonal, social, and psychological factors. Cultural expression. Cultural norms influence how depressive symptoms are expressed and perceived. In some cultures, somatic symptoms like fatigue and pain are more commonly reported than emotional symptoms. Socioeconomic factors, poverty, unemployment, and exposure to violence or trauma increase the risk of developing depression. Section 6. Seasonal affective disorder. SAD. Depression with a seasonal pattern. Seasonal affective disorder is a subtype of depression that follows a seasonal pattern, typically emerging in the fall and winter months when daylight hours are shorter. Symptoms mirror those of MDD but often include increased sleep, appetite, and weight gain. SAD mimics hibernation, low energy, hypersomnia, poor appetite. The culprit? Disrupted melatonin and circadian rhythms. Treatment. Light therapy, involving exposure to bright artificial light, is an effective treatment for SAD. Studies have shown that light therapy can significantly reduce depressive symptoms in individuals with SAD. Section 7. Comorbidity and complications. Depression often co-occurs with other mental health disorders, including anxiety disorders, substance use disorders, and personality disorders. This comorbidity can complicate diagnosis and treatment, leading to more severe symptoms and a poorer prognosis. Additionally, depression is associated with an increased risk of chronic physical health conditions, such as cardiovascular disease and diabetes, further highlighting the need for comprehensive care. Children of depressed parents face higher risks of emotional and behavioral problems. Depression is the third leading cause of disability worldwide. It costs the U.S. over $80 billion per year in lost productivity and treatment. Section 8. Pathways to recovery. Despite its complexity, depression is treatable. Effective interventions include psychotherapy, cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, have demonstrated efficacy in treating depression. Pharmacotherapy. Antidepressant medications, particularly selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed. Lifestyle modifications. Regular physical activity, a balanced diet, adequate sleep, and social support are crucial components of recovery. Integrated care. Combining psychotherapy and pharmacotherapy often yields the best outcomes. Understanding the multifaceted nature of depression is the first step toward compassion and effective treatment. If you or someone you know is struggling, remember that help is available and recovery is possible. Don't wait. Help is out there. Next episode. In our next episode, we'll explore bipolar disorder, examining the oscillation between depressive and manic episodes and the challenges of managing this complex mood disorder.